Thank you.
Hello, everyone, and thanks for joining us this afternoon for Unblocking Healthcare, making data more accessible with AllClear ID. My name is Jordan Leibovitz, and I'm part of the marketing team here at IMO Health. Before we get started, I want to take care of a few items for those attending. First off, this webinar is being recorded and will be available to you for future viewing. All attendees will be in listen mode, so if you have any questions or comments while our panelists are speaking, just type them into that Q&A section on the bottom of your Zoom control panel. And today we have Dr. Preston Campbell. He is the previous CEO for the Cystic Fibrosis Foundation. Bo Holland, who's the CEO and founder of AllClear ID. And then from IMO Health, we have Matt Red. He is our VP of New Markets, and Drake LaMonica. He is our product sales director. So without further ado, I'm going to pass it on over to Matt.
Yeah, welcome all. Very excited to be here today. IMO has a rich history, 30 years plus, of being kind of the foundational Rosetta Stone of healthcare, meaning the terminology layer at the point of care with the majority of the EMR vendors in the US and globally. I spent the last 24 years reselling electronic medical records, working on data aggregation, population health initiatives, and I would say this is one of the rare times where you truly work for a company, also partner with a company, and then show life events that are impactful to your own personal family. So very excited to talk about this partnership. Personally, the work that's been done here and how it's expressed itself forward, and the partnership that Bo has created with the CF Foundation has impacted my life and my family's life. I have a son with cystic fibrosis. Early days, very, I'd say late 20s, early 30s survival rate, and now it's up to God or whoever you believe in of what that expectancy is going forward. Huge foundational changes in that disease state that I think could be expressed to other diseases around the world. But a lot of it comes back to data and making true investments in the right area that's been impactful through this. IMO has historically been that foundational component in the Epics, the Cerners, the Meditechs, you name it, terminology vendor at the point of care. Been doing that for 30 plus years, and nearly almost every US hospital and provider to date. Company that's grown from being very provider focused to expressing itself into other verticals around the country in the world. So while we really focus on the EMR market, we've also expressed that same terminology layer and repurposing of that data downstream, now that it's all electronic, into, I'd say, life sciences, health tech vendors, payers. And that's how we came to fruition. Bo, I think it was back in February of last year, we first connected. 18 months later, have assisted and helped AllClear ID build one of the strongest patient health records that's controlled by the patient, not by the vendor in healthcare. And it's really made an impactful difference of how you communicate and how do you make data more interoperable. Jordan, if you'd like to move to the next slide. When we partnered with AllClear, it first started off as just structured data. I think Bo and the AllClear team saw that we had a unique capability that a lot of this data originated and started with IMO. And how do we normalize that data? How do we make sense of that data for not only AllClear, but for the patients? So we came into a partnership at that level. Later last year, we made an acquisition of Malax Technologies. That was an incubator NLP company based out of the UT Medical Branch. And we then explored that with AllClear, put that into fruition, blended that same terminology, that same data normalization into NLP, AI, FHIR capabilities. We've done a lot with Bo and AllClear over the last year and a half. And so it's really become a full suite of solutions of what we're doing around data quality and ensuring that anything that the patient sees or a physician sees is accurate and the data has been normalized. That's where it started. It's been a great partnership, a lot of back and forth, daily meetings, and what we've expressed to the I say to the world, and specifically for me, while there's great personal health records out there by the majority of the EMR vendors, this is the first one that's patient controlled, and they have access to all of their data and can share it with whomever they want or not share it. And it's a little bit of a different nuance. The growth that we've seen in the industry over the last 20 plus years of digitizing patient records and making it available has been tremendous. But when you get outside of network or a provider group, how do you share that is still a challenge. And I think Bo and AllClear has solved that piece, and we're helping enable it. With that, Drake, I'll let you talk through some of the specifics of the solution itself and how we're assisting.
Sure thing. Thanks, Matt. So the solution that we are going to focus on here with AllClear ID is the IMO Health Precision Normalize. Now, I realize normalize gets thrown around a lot as a term inside of healthcare IT. When IMO Health is talking about a precision normalize, we're talking about normalizing semantically, so aligning on the word. As Matt called out, we've got a significant number of clients who are providers leveraging our content inside of their EHR every minute of every day. The reason that they are is because IMO's foundational terminology allows the providers to express themselves clinically while being able to map those terms to code sets on the back end. When we talk about normalizing, we're going to be leveraging that content that exists to align clinical terms that come into a system, whether that be structured or unstructured, to then align with an IMO clinical concept and then have the appropriate mappings on the back end. What that enables is a full and complete picture of a patient at a glance. Matt, do you want to go to the next slide? So talking about that foundational terminology, the reason that IMO Health is so widely used is that we do allow, as I mentioned, the providers to express themselves clinically, but also on the back end, not only mapping to 1 or 2 code systems. IMO Health's general approach is, if it's necessary to map to, we will map to it. So you can see on the slide here, we have ICD-10, SNOMED, LOINC, RxNorm, CPT, NDC. There are others like HCPCS that you can think of when we're talking about commonly used industry standard code sets. That is what IMO is mapping to because that's what the industry uses. Now, if you look at the bottom of that slide, you can see the amount of work that IMO puts into this. This is our core competency. We not only have this corpus that's been built out over the past 30 years, but we also maintain that content over time so that we're ensuring that the content that's being leveraged by our organizations, whether they be providers or others, are actually are being leveraged appropriately with the most up-to-date code mappings. Matt, do you want to go to the next slide? So because of this foundational layer that IMO has provided, along with the footprint that we currently have in healthcare IT, we are uniquely positioned to be able to recognize when there is what I would call fragility in data. Oftentimes when data is transferred from one system to another, whether that be through minimum acceptance criteria, so on and so forth, there are elements in that clinical data that can be lost. So when we think about the diagnosis space here, IMO's called out 2 of these. We have an EHR, we have free text coming in from one EHR, we have an IMO Health term that's coming in from another EHR. As part of that transition, when that data is transferred, That secondary ICD code or secondary SNOMED code, which IMO has in the background as part of our metadata, can then be lost as part of that ETL process. IMO is able to recognize, because it is our proprietary term, when that secondary or tertiary data has been lost. And then we can use our normalized process to re-enrich that data to ensure that not only the original clinical intent is retained, but also the appropriate metadata that was captured on the front end. Matt, you want to go to the next slide? So when it comes to things like natural language processing, right? So when we're talking about structured data, I am focusing on a field and value approach. Think of it like a spreadsheet. In clinical language, when it comes to unstructured data, a significant amount of valuable and important data exists in an unstructured form, in clinical notes, documents. There are all sorts of areas in there where providers are expressing themselves in an unstructured way, right? And that includes things like clinical shorthand, abbreviations. There are time-based relationships that exist, or temporal elements as we refer to them in natural language processing. IMO, leveraging our experience, but also our expertise in all of these different areas, enables us to extract more complex clinical conditions and clinical entities than other NLPs out there, right? One of the key axioms in natural language processing is that an NLP engine is only as good as the data that it's been trained on. IMO has the massive corpus of content that we have to train that already award-winning natural language processing engine that we received with Melax, and then supercharged it by applying our content to it. So finding things like negating, right? There's this fallacy in healthcare data that the more data you have, the better off you are. That's not always true. It's important to retain the appropriate clinical data and what we call negate or kind of ignore certain clinical entities that aren't appropriate to be captured. So in this case, the patient denies up there at the top. You can see that. IMO's natural language processing and normalization engine is smart enough to understand in the context of that sentence that this clinical entity, while we recognize it, doesn't actually exist for this patient. And then also leveraging our deep knowledge of specially dependent language. Across the board, IMO is able to capture more entities and resolve them to clinical standards than any other NLP engine that exists. So what we did, and this is why AllClear ID engaged with us, was at a very high level, they had three main needs. One was access to that foundational terminology, the vast corpus that we have of not only clinical acronyms, synonyms, but also having those misspellings. Also needing a complete clinical concept representation. You heard me mention that there are multiple ICD or SNOMED codes that may exist for a given clinical condition. The more complex a condition is, the less likely it is to be represented by a single code. IMO, we capture all of the appropriate standardized codes for a given clinical condition or entity, period. But then also being able to extract that same level of specificity and granularity from unstructured text that exists in patient records. The objective of that was to ensure that regardless of system where the data originated, it was coming in to AllClear ID and Health Bank One and generating a singular, comprehensive, accurate, and universal patient record. So IMO provided all of that. We provided our expertise, our data standardization, not only from a structured standpoint, but also an unstructured standpoint, to ensure that the foundation of that patient record is as solid as can be. So Matt, I think that's the opportunity to hand it over to you, Bo.
Yeah, we're going to transition, Bo. That's the interlinkings, the infrastructure piece of it. Now we're going to get into what makes this all cool. right? But if you don't have that part set right, and then you're a patient or you're a physician looking at these clinical records and it's not normalized, doesn't make sense, you have issues. So now we'll get into the flair of what Bo and the team have built.
All right. Well, thank you, Matt. Thank you, Drake. Appreciate you going through the background and the data quality. That's the core reason that we came to you and established this partnership. At the end of the day, it's one thing to get the data moved around, but as we know, nobody's got time to go through all of this ocean of data. And so really having it be high quality such that it works for machine learning, such that it works for AI, works for analytics, that really is a key part of what we wanted to accomplish. So thank you for that. So introducing myself, I'm the founder and CEO of AllClear ID. So appreciate your time and glad to be here today. Most important thing about me, I'm not from healthcare. So people like Matt and Preston and Drake have been helping me get smart over the last 4 years of how to go solve this problem, which is deep and complicated. But fundamentally, our premise is that we want to unblock healthcare. There are so many places where patients get blocked, where researchers get blocked, where clinicians get blocked because of the information system that is developed over the years. It's the number one frustration to just about everybody in this space. And there's an opportunity I want to take you through to actually solve that. And the key to it really is patient rights. So the thing that people don't understand about what we talk about is this is not a technology model, right? We don't care what technology a payer has, a provider has, a pharmacy has. What is true is that the patient has a right to all of that data. And whatever information systems those organizations have, doesn't matter. But the patient has a right to get the data. We represent them and we help them get that data. And then we do the work to clean it up, no matter how it came in. So I'll take you through it. So if you go to the next slide. Just focusing in on the problem for clinicians and researchers first. Always missing records, or they're missing the consent to do something, including research. When they do get the data, it's these 800-page faxes that nobody's got time to go through. So you all know this problem. I won't spend any more time on that. On the patient side, on the next slide, you've got a situation where this is personal for me. My son is actually a survivor of a very rare brain cancer. And so in 2013, not the dark ages, right? This wasn't bears and knives time. This is a modern era. My son came home from his freshman year of college. He had a headache that turned into double vision, that turned into vomiting. And very quickly, we took him to the urgent care center and discovered on an idle Tuesday, he's got a golf ball sized tumor in the center of his brain that's been growing since he was a child. And so we went on one of these very complicated journeys. And so, I had one foot in the world of AllClear ID, where we're doing digital banking, moving the zeros and ones of money around the world instantly with digital identities. Very cool stuff that we have in the Nordic regions in Europe, capabilities that we don't even have here in US banking. And on the other foot, I'm having to physically cart CD-ROMs and pieces of paper between MD Anderson and Dell Children's in Austin to try to save my son's life. So you can imagine the awakening there of like, why is this so hard? Why is the information system so broken in this space between organizations that are only 180 miles apart that use the same EMRs? What in the world is going on? And so I have lived this slide, but every visit starts from scratch. Tell me your name again. The system doesn't seem to remember us. You only get 17 minutes of expertise per visit on average, and patients are not in control of their records. They're not in control of the costs, and patients really lack the medical knowledge to be actors. So very often, we as patients are just passengers along the way. We don't fully understand what's happening, what our options are. We don't even know what questions to ask many times. So these are the set of problems that we want to solve for clinicians and patients. So they're very different, but at their core, it's all about the information system that is moving the data where it needs to go when it needs to be there. So if you go one more slide, the root cause, in my view, is really the B2B model where businesses are sharing information between themselves is fundamentally defective. The system are all controlled by corporations, and corporations, we like them to compete. This is America. And so they don't like to share data with their competitors. That's totally understandable. But the consequence is the data ends up being scattered everywhere. Nobody's got a full picture of the patient, and the patient outcome suffers. Research suffers. Everything becomes really challenging when you've got this model. And as you can see, the patient is here on the bottom left, completely out of the loop. It's really backwards. And in the banking world, we do it in the opposite way. So this is really what we want to focus on. But let me, pause here and just I'd love to have Preston, you reflect on having actually worked in this environment, having actually made an impact on a disease, but I know there was a lot of work, a lot of money that had to be spent to try to get the data that you needed into your registry, to get the research done, and then get that data back out to your, I think you've got over 190 centers of excellence, around the country, getting that information back into the care system where it can be applied to individuals. So what has your experience been with this system?
Thank you, Bo, and hopefully this will highlight why I'm actually quite excited about a patient direct platform that you've built. So my background is as a clinician. I was in academia at Vanderbilt and Johns Hopkins, and I came to the CF Foundation in 1998 to run their medical scientific endeavors, and that included a patient registry that had been started in the late 1950s. And at the time that I arrived, the data was submitted annually on a CD to the CF Foundation and downloaded by a third party to populate our patient registry. So that was quickly changed to a web-based model, but that required at these 190 sites numerous people to enter the data from the charts or from the EHR if they had an EHR at the time. Into the patient registry portal. That was incredibly time intensive, was costly. The CF Foundation was providing tens of millions of dollars to the care centers to sort of afford this process to be completed and done correctly. And I say correctly because one of the concerns that we had is with this manual entry, there are a lot of mistakes made. And so we needed to audit every 3 or 4 years the data to make sure that we were actually at a very high level of accuracy with manual data entry. The time of these people could be better utilized. They could be doing better things and more important things to help patients with the lives that they want to live. And so the patient direct enables that because this manual data entry goes away, and better, the patient is basically put in charge of their data. We consent every patient for their data to be entered into the patient registry. With this system, it could be patient consented to whomever is running a registry, so that they can basically build their own registry outside of what the CF Foundation does. The advantage of patients having their data is that they are now motivated to understand their data. And with the AI component that's built into this, they can create data into knowledge and begin to see how they're doing. And not only can you see how the patient's doing, but you can see how care centers are doing. I'll just mention briefly that we've been very significantly focused on quality improvement efforts, and the median survival rose by decades without a significant advance in therapies for years, simply because we were refining care based on the data that we were monitoring in the registry. And the saying for us was, if you can't measure it, you can't manage it. And so I told Bo the first time I met Bo, the data is everything. And that's the reason is if you don't have the data, you're sort of flying without instruments in a very bad storm at night, and you're going to be in trouble before long. The last thing that I will mention is the advantage of a patient direct platform is the research capabilities that it opens up, and it really does this in spades. For a patient registry, you have to limit all the fields to the ones that you absolutely need, because you can't have this onerous data entry consuming everyone's lives. You have to limit the number of fields that you do. With the patient direct model and the capture of the data electronically, you're able to basically have all the real world data of that patient or patient population. And that means that patients from all walks of life, if they're willing to share their data, can be included regardless of where they live. And I will just mention that this enables observational studies to be done, real world data studies, and the FDA, just for for our registry, called it a treasure, because just to give you a reason as to why this is so important, we knew what CF looked like from our registry data. We knew how often people got pulmonary exacerbations or had to be admitted for antibiotics. We knew what their lung function decline was like, what their weight would be like over time. And so we knew how to design clinical trials based on all this data in a very informed way to make sure that people did not waste their time in studies that were underpowered and were never able to have to reach a conclusion about the effectiveness of a new therapy. So I think that having said all of that, the biggest thing that I'm excited about with the Patient Direct is that it puts patients in control of their data. And I think that that's what's right for this time. Patients should be in charge of their data. AI will help them interpret it. They don't need to be experts. They still need their clinicians to advise them, but they can go in with good questions for their physicians. They can also, we underestimate what patients can do, and for them to have their data and know what their cholesterol is doing, or if they're an adult, or what their risk is for a cardiovascular event, and they want to do better, and they're in a position now to manage it themselves. And that's what we really want. We really want preventative care rather than emergent resistant care. So I'm excited about this. It's the right thing to do at the right time. And I can see a great potential, not only for the CF Foundation, if they choose to use it. They're in the middle of a registry rewrite right now, so it's not time for them to consider this. But for them in the future, and for a lot of other patient organizations, this is a solution that they absolutely need. And it doesn't need to be orphan diseases. It can be large diseases as well. So I'll stop there, and hopefully I didn't ramble too much.
Oh, well, thank you, Preston. And Matt, I wanted to bring you into the conversation because you've lived this as a patient, as a parent.
Yeah, absolutely. I just going through it this weekend in preparation for this meeting. I was looking back through the historical records that we have as a family with our son. I have 3 applications right now from 3 different provider groups that are based on I say EMR vendors that are all siloed patient health records. They've gotten much better with sharing that data, making it more interoperable, but it's also time consuming and a challenge. Full transparency, I was with Microsoft at the point where we were promoting the Health Vault application. What Bo's done is taken that and made it times 10. So his company versus Microsoft, obviously the revenues are a little bit different, but he's taken that same concept and made it reality to the point where now we control that data and we can easily share it with every physician we see, provider group. A lot of times in chronic conditions, you're seeing multiple specialists or trying to get a second recommendation, right? Outside of even your payer network, if you have that feasibility to do it. And being able to just share that data directly and control it versus kind of waiting for maybe another third party to share it means all the world to our family. It makes it so much easier and cleaner. Back when I was a child, my mom had breast cancer, and I remember the days us getting on airplanes to go find another specialist with stacks of medical records. That was our carry-on luggage, with stacks of medical records. We solved that. We've digitized it, but now the sharing of that data is becoming more and more controlled, but now opened up. And so having one place to go as a consumer means the world to our family.
Well, it's had the same impact for our family and our son for sure. So thank you for that. Well, last thought on this slide, and let's move into the solution and what it actually looks like. There's another way to do this. Again, I come from banking, and in the banking world, we tried to build all kinds of B2B networks, and we have hundreds of them. Where different banks connected to different banks for different purposes, payments, overseas transactions, you name it. We tried all these things, but ultimately we never could keep up with the consumer. Where the consumer was going and where they wanted to make their next payment, where they wanted to move their money next. And so the B2B model in banking really failed. We couldn't do it. And so we finally switched and said, you know what, let's start giving the consumer the control And what we did is invented credit cards, and that is a secure credential that you can hand to a patient or to a consumer. And now the banking data travels with the consumer. If you think about what is on that credit card, what's on that chip, it's your banking information, how to do a secure electronic transaction with you anywhere you go in the world. And so that's really the model that I'm going to show you that we put in place here. So if you go to the next slide, I want you to imagine a couple of things. The opening here really began in 2022. So back in 2016, the Cures Act was passed, but the final rules actually went into place, and Mickey Tripathi and crew, God bless them, actually pushed this through and said, enough, we're going to make this be true. It's going to be actual. So on October 6th of 2022, patients got powerful. We got non-negotiable rights to our data. We got a portability standard called FHIR, Fast Health Information Resources, that allows you to move that information around, and it's mandated that every industry player, every covered entity has got to support this standard. We've got an identity standard for how do we know who you are such that you're able to exercise these rights. So that's now in place. It's the NIST standards, interestingly adopted from the European standards that we've been working with. And then finally, regulatory fines. So there's actually a penalty now if you're information blocking. And so the basic pillars of open healthcare became law, and this is the foundation we're building on. And again, I'll repeat, this is not a technology model. This is a right that you have the right to the data, and our strategy is all of the above. We don't care who your EHR vendor is. We don't care, how big and powerful your institution is. The patient has a right to this data, however you can produce it, and then we'll do the work to get that converted and get that turned into something useful. And that's the key to the partnership here. So on the next slide, imagine you have a sharing system that's now controlled by patients instead of the corporations. So a patient can now have all their records in one secure place under the patient's control. And that's not a new idea. People have been dreaming about this for a long time. It's obvious. It should exist, but it never has been able to actually work until now. And the second piece we wanted to bring in is it's not enough to have the data and the records. You need intelligence on top of that for everybody involved in the patient's care. On the patient side, how do I interpret this information? Right now I have it, but I don't understand it. How do I interpret it? What questions do I need to ask? And the AI can be terrifically helpful on that side. On the other side, for the experts, the medical experts, they don't have time to go through the whole pile of a complex patient like my son or Matt's son. And so they need to be able to use the AI to get exactly what they need and get through that stack of hay and find those needles, very, very quickly with high quality data that then they can plug into their systems. And so the AI plays a really important role in solving the communication problem, not just records, but now the communication on top of that between patients, clinicians, and researchers. And the last piece is we really wanted to build on the next slide, really wanted to build a system that didn't have any gaps. So the fundamental problem that every app, every personal health record has had, including the Microsoft one, including Apple Health today, is that they have gaps, right? You try to use these things and you find out one of your doctors is, you can get the data, or maybe two if it's on a good day, but the rest of your doctors, your pharmacies, your healthcare plan, you can't get the data. And that's because they've all been tracking on a technology approach. So here, again, this is a patient rights model. It says, we don't care what technology the different organizations have. So now the patient can order their records and they can provide consent for any use case. There's no limitations on that. But now you can get the data from any provider, any payer, any researcher, any pharmacy, and then use this technology in these pipelines that we built to consolidate that information, normalize it, digitize it, put it in a safe environment inside of a bank where you've got banking grade security and privacy, another piece that's sorely lacking in this healthcare industry, and then enable GPT-4o. So we're not an AI developer. We've developed the infrastructure to be able to run the AI and provide the way for the AI to access your medical records in a safe and privacy respecting environment under the patient's control. So we're starting with GPT-4, which is currently the gold standard. We are expecting better AIs every day coming from trusted brands, and we'll be loading those in as we go forward. But the big thing we focused on the last year and a half was demonstrating that we can have a 100% success rate in retrieving medical records. And that simply hasn't been possible before. It hasn't been done before. Maybe you can get 25%, maybe you can get 50, maybe you can get 70 through these B2B schemes, but nobody's able to get 100%. And I also include in that images, right? For my son, for Matt's son, images are everything. You got to have the images. And so this platform includes that as well. And so often that is just missing in these different schemes. So One last slide, and we'll go to the product. We are introducing Health Bank One. And so think of this as a new kind of bank that enables patients to take control of their medical care and solve this information sharing problem, solve this communication problem. And on the very last slide here, we've actually done this before. So AllClear ID, we've been around since 2004. So operating the last 20 years, the past 8 to 9 years, we've been pioneering open banking in Europe. So we've seen this video before. And so this is part of what I got excited about when I saw both had this personal experience with our son and then saw the new laws that came into place. These are the same kind of laws that enable us to do open banking in the EU. And so basically the Europeans had a situation where the banks were squelching innovation. They were raising prices. The banks were super happy, but nobody else was. And so they passed a law that said, you know what, let's give consumers control over their data. And now consumers can decide where their data is going to go. They can connect any third-party application they want to their bank account and use this data. It really opened up innovation, and we get amazing companies out of that. Prices are down, competition is up. And lo and behold, the big banks who said the sky will fall if you do this, sky didn't fall and they are doing just fine. So we're basically bringing that exact same infrastructure that we built to move the zeros and ones of money safely around the world and instantly around the world. And we've spent the last 4 years applying that to this particular space. So let me show you how it works. So I'm going to share my screen and let's do a demo.
We can see it, by the way.
Perfect. Thank you. So let's start off with what you get on the research side and on the clinical side. And this is all synthetic data, by the way. But what I'm sharing here is a portal that we can give you access to. And so if all you have is a web browser and internet connection, you can do this. If you've got a fancy EHR that has APIs and cool stuff like that, this is a modern Kubernetes microservices-based application with lots of APIs. And so we can push and pull data into your environment that way. We support over 100 different EHRs using a product called Redux. But for demonstration purposes, this is a great place to start. So you've got a patient. We maintain all the personal information, the content information, et cetera, et cetera. You've got a binding between the health bank system, the patient's health bank ID, and your internal system. So this might be an MRN, it might be some other unique identifier. If you have 5 EHRs and you've got a research system to boot, that's fine too. We can support multiple unique identifiers, so you can always tie the patient to your system, to the right record, and eliminate this misidentification problem, eliminate the patient record duplication problem, eliminate the mismatch problem. We don't have those problems in banking, and now with this capability, you won't have that problem in this space either. But the data is really the highlight. And so what you're getting is data that you can see here has been cleaned up, it's been normalized. Let me show you where it starts. So very often you might get a fax from somebody. And so let's go look at this one here. And this is the kind of input problem that we wanted to tackle. So here you've got, let me get to the top, from a small Smith Cardiology, right? They've got an old EHR, it doesn't do much, and you're literally getting completely unstructured data in the form of a fax that nobody's got time to go read through, and the patients certainly don't understand it. So we start with this kind of data, and whether we receive it in this form as a fax, as a PDF, or we receive it as nice FHIR data or pumped through a Redux API. What we do is take that information and then we turn it into something that looks like this, where everything is structured. So all that data comes out of that PDF. You literally drop that PDF into one end of the pipeline. It does 15 different steps of processing, and out the back end, now you get clean data. So once the data is in the bank, this is what you will get as a member of the bank, is clean data. You don't have to read through those PDFs anymore. This is ready for analytics. It's ready for ML. You can see all the different coding systems that Drake was talking about, including the IMO Health ones and so forth. So everything is here. But even with that, nobody has got time to go through it all. So what we've done beyond this consolidation, normalization, and digitization, now we've introduced Care Guide. And so Care Guide is using GPT-4o today, as I mentioned. But now you can do things like, let's go grab that file. And I will grab a file. Either I can do some from my from the patient's medical file or from my computer. I'll show you both. And let's go grab this one here that we came in, and let's get a summary. And so now I can just ask, the AI, please summarize this report for me. and let it go do the work. And now if this patient has, 8,000 pages of documentation like my son does, it will go through and you can ask any question about the patient and you will get the information quickly in terms of what is going on with this patient. So this is invaluable for a clinician who has, 20 clinical visits the next day. I can get quick summaries. Here's the demographics. Here's the medical summary. You can see quickly what's going on with this patient, the current complaints, lifestyle. All this came out of that PDF, right? And I can ask any question I want. When were these vital signs taken? It's great. It's right here for me. The lab results, great. Here we go. So any question that I've got, I can now drill down and keep asking, but I can get exactly what I need. Now, I'm noticing this patient has got a history of a brain tumor, a history of radiation. I may also be a researcher, and I'm thinking, gosh, this person may be a great candidate for a trial that we've got going. So I'm going to add another file from my computer, and let's find out if this patient is actually a candidate for this trial. Now, this is something that will take a qualified medical professional several hours, to comb through a complex patient background. I'll show you what I've just loaded into the context, and it's this. So this is a real trial for semaglutide patients, for people that have obesity, and they've got type 2 diabetes, and they've got heart failure. So what I've done is loaded in the inclusion criteria, and I've loaded in the exclusion criteria. But rather than paying a human to go do that labor and comb through this, CareGuide has already done that for me now. And so here you go, right? Here are the results. So on the inclusion criteria, right? Yes, it's met. BMI, yes, it's met. Yes, heart failure, liver diagnosed. Yes, yes, yes. Exclusion criteria, it does the same thing. This one may be a no. You're going to have to check that out. But based on this, the patient meets all of the requirements, right? So just very quickly, all of this work to pull the needles out of the haystack and to do that kind of analysis, you can let the AI do the first cut on that. And then you've got all the base information over here in the medical records to actually ground that, to have the provenance of exactly where that data came from, so that you can verify that the AI has been accurate, that it hasn't hallucinated. So you've got both pieces of the puzzle here. And going forward, we'll be enabling this capability. Say we have 1 million, 2 million, 3 million people in the health bank. Over time, you'll be able to go in as a researcher and say, how many people meet the following criteria? It'll help you design your trials. It will help you now connect with these patients and say, would you like to be part of this trial? And so being able to do these kind of analysis across a population is going to really be powerful. So that's a quick fly through of what you get on the researcher and clinician side. Let me switch over and show you the other side where the control is and the patient's experience. And so this is the mobile app, simple mobile app, but underneath this is a high security digital ID. We don't have these in this country. This is technology that we developed for these digital banks in Northern Europe that are about 10 years ahead of where we are. But fundamentally, it's just a mobile app. But you've got a digital ID here with QR code capabilities where you can bootstrap all kinds of processes, things like check-ins, things like, hey, let's get connected. Would you share your record with me? In the center, you've got CareGuide. So the same AI capability is now available to the patients. But let me focus on the records real quick. I'm going to go to the records tab here at the bottom, and you'll see that I have the very same view with the very same conditions and so forth of everything about this patient. And you can see that everything is, again, clinically coded. So the patient has got the same data. It's in their account, and basically we're sharing the view, right? So the patient's got the data. Anyone that the patient has decided to share with has also got the data. Ordering records is super simple. You just tap this button here, order records. Let's say I want to order some records from the CMCA. I can order the records. I can order the images. I can order both. I'll just do the records. And then I can see, okay, the digital download is not available. This group hasn't done their firework yet, but they do have standard delivery. So the system will literally send them a fax, and we'll use the old methods. And this is how we get to 100% coverage, where we have 0 gaps. We can always get the data. And we've already shown you how, even though we get that unstructured fax back, we will turn that into high quality data that you can use. But boom, I'm done. And then I also get an indication, these guys deliver in 2 days. So the nice part about the digital delivery is that that comes in minutes. So overall, the system is very fast. When the patient orders their records, if it's from a provider or a covered entity that is in compliance, you'll get it within minutes. If they are not in compliance, you will get it within days. All of those numbers are much faster than what you get with the current ways of sharing records. The last thing I want to show you is Care Guide and what does this do for the patient. So let's go try this. And so I can say, hey, I'm not feeling well today. So anytime, night or day, Care Guide now has access to all my medical records. And so it'll do things like a symptom check. So what's bothering me? Tell me how to understand and assist it. So I can start understanding, do I need to, go to the doctor? Do I need to go to an urgent care? Do I need to do something? But now I can start to get educated about it. Let's do something else. Let's say I am been following, Peter Attia and trying to improve my health span and lifespan. And, I've just gotten my lipid results back, but I don't really understand them. So, let's have a chat about them. So I can go grab this lipid panel that's right here. And now, if you're a professional, you understand what all this means. You understand the ranges. As a patient, I have no idea. And so I'm just going to say, how am I doing? And so you see here the interpretation capability where now this data that's coming to me, I can use Care Guide to actually understand it and get educated. And so very quickly, it gives me some plain language information. I can translate this into over 50 languages if I've got family members that need to understand this. And I can ask as many questions as I want. There's no timeout, right? There's no 17-minute limit here on my ability to get smart about this and understand what I need to do and ask all the questions that I need to ask. And I'll do one more just to show you an example of the depth of this. So we'll add one more file, a genetic test. And so I have permission to share this from a colleague of mine who he and his wife were pregnant. They were all excited. They went to the doctor, had this genetic test done, and it turns out there are 3 little markers over here at the bottom right. And many of you know exactly what that means. Most patients have no idea what this means, but now I can use Care Guide. So this family got news that their daughter has an extra chromosome in chromosome 18, 3 copies of it. It's going to be a real issue for them. It's going to change their life. And so they heard this, they black out from the stress. They get back in the car. This is the piece of paper they got in the car with. They go home and guess how many questions they've got? About 1,000. But now with Care Guide and this capability, one, they have the record, and now they can ask, please explain this. Please explain it in layman's terms, right? Simplify this for me. Bring it down to something I can understand. And so this, again, just a demonstration that, what this application feels like to a consumer. You can see here the results. It's karyotype. Normally you have 46, you've got an extra pair, right? And so it goes in and starts giving me this information. And now this family can ask and ask and ask and really start to understand this, including asking, what questions do I need to ask at the doctor's visit? How is this going to impact our life? Prepare an agenda for me. So my hope here is that we patients can show up a lot smarter. And rather than talking about the little things and everything going over our head and just being a passenger, now we can have really meaningful conversations with our physicians to understand this. So we hope that this is an improvement in the capability. But what you've got here in GPT-4o with the training that we've done, specifically training it on the individual's medical records with this very high quality data that AllClear and IMO put together, you get a very different experience that has never existed before available to the patients. And the last piece I'll share with you is the control. So let's say I'm going to share data with the CMCA bank. Right here, any provider that I want to, I can receive records, I can share records. It's that simple. And we've got I'll add a provider here, a national database of everyone that's got an MPI number. So you can look them up by provider, you can look them up by the organization. And so now I, as a patient, am able to build my own HIE, right? I can connect the people that I need to get connected. The ones where my son goes, not the ones that the big institution wanted to connect with, but the ones I need to connect with. And I can do this globally, right? So this is my hope here. This is what we built. That's the functionality. Let me pause there, and I think we've got a question. I'm going to stop sharing.
Yeah, so I'm going to launch a really quick poll question. If you look on your screen, how will medical AI impact the communication between clinicians, researchers, and patients? So if you don't mind just filling this out, and then we'll give it a... right. So far it's it will improve communication. And that is majority of people.
That's the hope. All right, well, let's open it up for questions. What have we got?
Right. If you don't mind filling out the Q&A section at the bottom of your console, that would be great. All right, so how is this different from other patient medical record vendors? Like what makes this one different? Oh, I'll go to you.
Yeah, I'll start off on that. So I think the most important difference is the fact that it has no gaps in coverage. So wherever you've gone to the doctor, from the biggest institution down to the smallest corner doctor that's just in a one-person shop, you will be able to get the records, independent of what technology they have. Whether they are literally handwriting their documents, that's fine. We can take them and we can convert them into high-quality digital data. We have done this. Or they've got APIs. So you no longer, this is the one product where you do not have to worry about, can I get my data from all my doctors? Because this has been the bane of the existence of every time someone has tried this before. The capability has not been there to actually accomplish this. But now you've got a right to it, which is a legal right. And so there's no question about can you get the data? And now it's just about how. And we have built a model that we don't care how the data comes in, handwritten all the way to API. We'll take it, we will clean it up. And then when we share it back out, it will always be this high quality data. And that's really differentiation number two, is when you pull data from the bank, you're using the patient's consent. You don't have to play mother may I with, big institutions anymore. If you want the data, the only person you need to ask is the patient. And if the patient is interested, they say yes, boom, now you're getting high quality data. And so the last piece is that we've added in this AI component with banking grade security. And so that again is fairly unique. I have not seen anyone that has done this and enabled that AI to help everybody involved in a patient's care, whether they're the clinician, they're a researcher, could be your next door neighbor, and of course the patient themselves, to really understand their care and know which questions to ask.
Bo, on a follow-up to that, just for the audience sake, based on the legislation that was passed and that kind of started this and made this real, what's the expected turnaround time for a patient? So when they request the data through Health Bank One, you go to Saddlebag Regional and try to request that data. What's the legalities of how quickly I should be turned around? Because I think pretty much everyone on this call has probably spent hours and hours of their life calling medical records departments at hospitals to get it digitally or even just hard copies over time. That game's changed. So can you speak to that a little bit and what should be expected as a consumer?
Definitely. So, we've got sort of two ways to order records. And so the first one is for the entities that are in compliance with the law. They have stood up their Fire server as a companion, to their patient portal, right? Your patient portal spits out human readable, PDFs. What we really want is machine readable data, and that's what the law requires. We believe about, 40 to 50% of the institutions have actually done that work. And so very often, you will be able to get your data instantly, within minutes. And so you order, when you place that order, the system will show you, yep, this group is in compliance. You'll be able to get your data right now in minutes, through Fire. And you just put in your username and password to authenticate yourself to your provider, and boom, you'll have the data in just a minute or two. So that's the best way. And over the next 12 to 18 months, we'll see that compliance going from, sort of 40 to 50% where it is now, up into the 89% level. If your provider, the data holder, is not in compliance with the law, one, we're going to nudge them on that and push them along. Come on, get this thing stood up. You need to do it. Your EHR vendor has made it easy for you. Just get that thing done. But in the meantime, we'll use the old ways. We'll use standard delivery. Literally, the system will send them a fax. And then we actually monitor and measure how quickly does each provider do it. By law in the standard delivery world, they have up to 30 days. But we're finding that one of the nice pieces is that when the patient is ordering from their own doctor, the organizations prioritize that. They put those at the top of the list, right? If the third party, if the researcher ordering it, right, that goes to the bottom of the list, and it may be months before you see that data. When the patient is ordering it, which is always the case in our system, literally you're getting it within days. So our average delivery, even on these standard deliveries, is about 7 to 8 days. And that is way faster than all the other ways of getting data today. So either in minutes or a few days, but either way, you're getting top priority, and speed here and the data quality, are really key features.
Absolutely. I think we're run up on time, but Jordan, I think there are a few questions.
Yeah,
in the
there's a few
Q&A.
that came in.
Mhm.
And we do have a few minutes left. Who are the early adopters of this new HealthBank One technology? Oh,
Yeah, so where we've seen the most interest has been from the research community. On the pain scale of 1 to 10, these guys are a 12 and a 13, trying to find patients for their trials, trying to get the data extracted from the health system, to be able to qualify them for the trials. And there's a lot of money at stake, a lot of pressure to get those trials sped up. And so that's really we launched an early version of this platform back in January, and we've got several research organizations that have been using it, helping us make sure that we get it right. And I'm happy to say we've gotten through all of the commercial gates, right? The security, the compliance, the privacy issues, and of course, most importantly, the operational issues. And so, the feedback has been the speed is great, the quality of the data is wonderful. This works better than any software that we have, right, to do this job today. And so that's really where we had started. On the 15th, so next week, we're going to be opening this up to the public. So any consumer, any patient out there that wants to have access to this app and get their records and use the AI, they will be able to just simply download it from the App Store. So that will be opening up next. And then we think other groups will come along, provider groups, payer groups. Everybody needs this data. And, our supposition is if they can get the data with the consents, they can get it quickly, and they can get the data with high quality. The people who need the data will follow their own patients and start getting it directly from them instead of this madness of the B2B negotiation world.
great. And if anyone needs to drop, feel free, but we can get through these questions if that's okay. How scalable is this technology?
Very. My architect that I hired to help me plan the system, was a chief architect for the Visa network. He built the PayPal network. So this is not, EHR technology. This is banking technology. And so we're using that very same infrastructure both to enable the scale. But this is a, full-blown modern Kubernetes microservices-based application that will scale to the moon. And the security and the privacy are other key points. And so you'll notice in that, the mobile app that I showed you, it's a banking grade digital ID that we've been using in banking for real banking transactions, 1 billion transactions a year. We don't have identity theft. We don't have any scalable fraud. We don't have data breaches. This stuff really, really works. And so bringing that sort of technology infrastructure that gets you both the scale, the privacy protection, and the security that we have built and developed in the banking world, for many, many years. It's proven out, right? The Visa network scales, and this is using the same kind of capability underneath it. So a very different architecture and design principle that we're bringing from the banking world to healthcare.
Okay. We have time for one more question. When patients use Care Guide to help guide them along their journey, how is this use of Care Guide being received by providers?
Well, that's why we asked the question. And so we've seen some providers who say, this is wonderful. I really want the patient to be involved in the decision. I want them to understand, but I only get so many minutes with them. And these are complicated, this is a complicated subject matter. And so the comprehension issue and the communication issue is really challenging. And so we have already seen, with patients and with doctors who have used this together, we have seen, the communication quality go up, the comprehension go up. We've seen the visit not be about, tell me what medications you're taking again. You're wasting your 17 minutes. Now it's about the real issues because the patient understands them. They understand this is chronic. I know why you're telling me this now, doc. Now let's get to the real issues of what do we need to do? What are the options and what are the decisions? So we have already seen that. We have also seen doctors who have glazed over and said, oh my God, here's another tool. I remember how bad it was when people got access to Dr. Google and WebMD and came in with all kinds of bad information. And I had to spend my 17 minutes correcting them. So we've seen doctors that have, literally, shut down and go, oh, this is going to be just terrible again. But many of them have not actually experienced AI. They haven't seen the fact that instead of getting a bunch of links that send you off to God knows where, to pick up whatever that's what Google does. This technology gives you very specific answers that are high quality. And it's not perfect, but what I can tell you is it is really about 1,000 times better than Dr. Google and WebMD today. And this is the very worst medical AI you're ever going to use, right? This stuff is advancing quickly. It is getting better. It is getting trained by the best. And so, we think it's just going to it's already way better than the options out there today for a consumer, and it's going to get way better. So we hope that, more physicians will be interested and actually have more meaningful, productive conversations with their patients instead of the ones they're having today. And we hope that they enjoy that. I'm sure not everybody will.
Awesome. All right. So I think we're going to go ahead and close out for today. We know there are a lot of other ways you can spend your time during your busy workday. So thank you so much for joining us. I want to give a shout out to our awesome panel today. So Bo and Preston and Matt and Drake, thank you very much. What an awesome solution and everything. And I'm so glad that IMO Health could help with that. Thank you again. And just be on the lookout for the recording. I'll send that later in the week, and have a great day.
Thank you all.